Hello, hi, my name is Dhruti Patel. I'm the FNP student and I'm doing like a podcast in advanced pathophysiology. Hi, today's podcast title is Atherosclerosis, how arteries become clogged and what you can do about it. So, hello and welcome to the today's health podcast. In this episode, you will get to know atherosclerosis and one of the most prevalent cardiovascular disease worldwide that affects millions of people because it is a major risk factor of the heart attack, stroke, and the peripheral artery disease. It is important to understand this disease. Atherosclerosis is a disease that occurs when fatty deposit called like plaque accumulate within the wall of the arteries. This plaque consists of cholesterol, fats, calcium, and the inflammatory cell. Plaque can build up, making the arteries like a narrower and non-flexible, which can limit blood flow to the organ and tissues. Atherosclerosis is a slow process that may start in a childhood and then may can take like many years to develop. When the lining of the artery become damaged, it causes the inflammatory reaction. The cholesterol then build up at the damaged spot and eventually create plaque that may plug up to blood flow or burst and creating a blood clot. There are numbers of non-modified risk factors that promote atherosclerosis. Age is the one of the most important because as time goes by, the damage of the arteries increases. Family history also plays a role and is more likely to be a risk if other close relative has suffered cardiovascular disease at an early age. Moreover, there is a difference between sex. Men develop atherosclerosis earlier than the women's, but increasing risk in women is after menopause. Thankfully, many risk factors for the atherosclerosis are controllable. When LDL means low density lipoprotein cholesterol is present in high levels, it is difficult for it to be trigger plaque formation. Food high in saturated fat, trans fat, and processed food lead to high cholesterol. Another risk factor is smoking, which can harm blood vessels and cause inflammation. Physical inactivity and obesity also add to the cardiovascular risk by causing high cholesterol, high blood pressure, and insulin resistance. Atherosclerosis is also a significant risk factor for diabetes, as high sugar harm blood vessels and cause increased plaque formation. It is important to control these factors in the lifestyle to significantly slow this disease process. The heart is not only the organ to be affected by atherosclerosis, but poor blood supply to the brain may lead to TIA or a stroke. PAD is the pain that occurs when arteries in the legs narrow. The kidney may also involve causing kidney failure and high blood pressure. The goal of prevention and management are to lower cardiovascular risk factor, eating a diet that is good for your heart, including plenty of fruits, vegetables, whole grains, and lean proteins, exercise, quitting smoking, diet, and the blood pressure is a vital prevention tactics. In some instances, drugs can lead lower cholesterol level and the decreased cardiovascular risk may be like that include statins. Atherosclerosis is a slow development disease that is caused by a combination of genetic and the lifestyle risk factors. Some risk factors can't be modified, but cardiovascular health challenges can be prevented and complication can be minimized with healthy decision. Thank you for your ears and keep in mind that little changes now will help you keep your heart healthy for years to come. Thank you.